Hello my dear viewers, welcome to AI Medical School. Today I'm going to explain to you, what are uses of the betamethasone drug, its benefits and everything. Let's get started. Betamethasone is a synthetic glucocorticoid, the most active of the anti-inflammatory steroids. It used topically as an anti-inflammatory and administered orally as a replacement therapy for adrenal insufficiency. It relieves inflammation in various conditions, dermatologic disorders, gastrointestinal diseases, and hematological disorders. Indications: betamethasone is primarily indicated for the treatment of several inflammatory conditions, allergy, asthma, contact sensitivity reactions, insect bite reactions. Betamethasone is indicated to relieve pruritic and inflammatory symptoms of corticosteroid-responsive dermatosis. Betamethasone can be used topically in combination with a vitamin D analog such as calcipotriene to treat plaque psoriasis and other skin diseases. Contraindications: betamethasone is contraindicated in conditions like herpes simplex infections, acne vulgaris, perioral dermatitis, hypersensitivity, napkin eruption, and skin lesions. Side effects: the severe or irreversible adverse effects of betamethasone, which give rise to further complications, include atrophy, skin fragility, angioedema, perioral dermatitis. Betamethasone produces potentially life-threatening effects which include Cushing's syndrome, diabetes, hypertension, growth suppression, which are responsible for the discontinuation of betamethasone therapy. The signs and symptoms that are produced after the acute overdosage of betamethasone include convulsions, electrolyte imbalance, abdominal distension. The symptomatic adverse reactions used by betamethasone are more or less tolerable. And if they become severe, they can be treated symptomatically. These include vertigo, headache, diarrhea, fever, anxiety, constipation, abdominal pain, sweating, erythema, hypotension, arthralgia, acne, hypersensitivity reactions, menstrual irregularity, cataract, hypertrichosis, pigmentation, superficial blood vessels dilatation, local hypopigmentation, superficial blood vessels thinning, peptic ulcer, skin thinning, subcutaneous atrophy, ocular changes. Now the warnings are: betamethasone should be used with caution in patients with active tuberculosis infection of respiratory tract or in untreated fungal, bacterial or systemic viral infections. Corticosteroids should only be used systemically with great caution in the presence of congestive heart failure, recent myocardial infarction, hypertension, diabetes mellitus, epilepsy, glaucoma, hypothyroidism, liver failure, osteoporosis, peptic ulceration or renal impairment. Children may be at increased risk of some adverse effects. Corticosteroid causes growth retardation and prolonged use is rarely justified. Passive immunization is recommended to non-immune patients who do come in contact with chickenpox or measles. Live vaccine should not be given to patients receiving high-dose systemic corticosteroid therapy nor for at least 3 months afterwards. May killed vaccine or toxics be given, although the response may be attenuated. During prolonged treatment with corticosteroids, patients should be examined regularly. Sodium intake may need to be reduced and calcium and potassium supplement may be necessary. Patients should carry cards given full details of their corticosteroid therapy. Avoid use during pregnancy. Use nasal steroids with caution until healing has occurred. Long-term therapy should be avoided especially in infants and children as adrenal suppression may occur. Care should be taken so that the preparation does not enter the eyes as glaucoma may result. In secondary infected lesions, antimicrobial therapy should be used in cases of spread of infection. Topical steroid therapy should be stopped. Prolonged application on the face should be avoided. High-risk groups: drugs should not be given to pregnant mothers, patients suffering from kidney dysfunction, and neonates. If prescribing authority justifies the benefits of the drug against the possible damages, he or she should re-evaluate them. Now dosage: the adult dose is 0.05 to 0.1%, frequency 8 hourly and route is topical, and the oral dose is 0.5 to 5 mg, frequency is 24 hourly, and route is oral. Now the brand names: Betazole, Betagenic, and Betaderm. I hope you guys liked the video. If you found this video helpful, so please consider the subscribing to channel and hit the thumbs up. Thanks for watching.